Hey guys, so I want to talk to you about a really common condition that I find with a lot of my clients. They come in complaining of what you've probably heard of SI joint pain, and that is pain that occurs on the back side of your pelvis where your sacrum and your hip bone connect or come in contact. And that can be on the left, right side, or both sides. We tend to see this as a common complaint during pregnancy or postpartum, just because we get a lot of tissue tightness, muscular tightness, and different compensation patterns, and a lot of weakness that can cause this SI joint pain specifically. So we want to make sure that we're looking at the strength of your glute muscles. How's your hip mobility? What is the strength of those back muscles for supporting purposes? We also want to take a look at the structures on the front, right? Your deepest core muscle plays a huge role in supporting those SI joints, and your deep core can be definitely affected through a lot of life events, especially during pregnancy and postpartum. And then big one is going to be those pelvic floor muscles as well. Those pelvic floor muscles that are internal within the pelvis definitely can impact the way that your sacrum and spine and hips are feeling and moving as well. So if we have a lot of tension or tightness, which we tend to find in the pelvic floor, it can really pull and crank on your anywhere on the hips, but we find that it can be a big component in pulling and creating those symptoms into the SI joint area and into that low back. So really important to make sure that with SI joint pain that we're getting full assessment of your whole skeleton externally as well as internally, because they all play a really big part in making sure that we can heal that SI joint pain and keeping you pain-free. So if you or you know someone who's having this SI joint pain, definitely reach out. You'll want to make sure you see somebody who is a pelvic expert physical therapist that can definitely give your pelvic floor an assessment along with the rest of your body, so that we can really get to the root cause of what is going on.